Hello and welcome to our daily update on COVID-19. It's March 21st, Saturday. In the next few minutes, we will bring you updates regarding the spread of the virus from across India with specific focus on Bengaluru and Karnataka. First up, at the time of this recording, 316 people have tested positive for the novel coronavirus. That's an increase of 67 since yesterday. The number of deaths is stable at 4. Gujarat has added 6 more positive cases since yesterday, bringing the tally to 13. In West Bengal, a woman with a travel history to Scotland has tested positive, taking the state figure to 3 positive cases. Ladakh reported 3 more positive cases today. The newly formed Union Territory now has 13 cases of COVID-19. Maharashtra has detected 12 new positive cases. Currently, the state leads the tally with 64 positive cases. In Karnataka, 5 new cases have been reported. This is the steepest rise in the number of cases in the state since the first COVID-19 case was reported on March 9th. The total number of confirmed cases in the state now stands at 20. Patient 16 is a 53-year-old woman from Bengaluru. She is a high-risk contact of patient 11. Patient 17 is a 35-year-old man from Bengaluru with a travel history to Amsterdam. He arrived in Bengaluru on March 19th and tested positive today. Patient 18 is a 21-year-old man from Bengaluru and has a travel history to Edinburgh, Scotland. He arrived in Bengaluru on March 17. Patient 19 is a 31-year-old man from Chikbalapura. He returned to India on March 14 from Mecca, Saudi Arabia. Patient 20 is a 35-year-old man from Mysuru who returned from Dubai on March 19th and landed at the Bangalore International Airport before making his way to Mysuru. All patients have been moved to designated isolation hospitals. Karnataka State Health Department Director Om Prakash Patil has directed the management of all e-commerce services to mandatorily provide masks to the delivery executives working with them. These masks need to be changed every 4 to 6 hours. The Karnataka Health Department has formed as many as 500 two-member teams across the city comprising of a beat constable or home guard and a health worker. These 2 members will go to every house of international passengers who have arrived in the city in the past 14 days but have not been stamped on their left hand. The stamping began only on March 19th and the department wants to make sure that nobody is left out in the process. The state has also identified 48 government hospitals and 35 private hospitals as first responders for COVID-19 cases. In addition to this, Karnataka has shut Dakshina Kannada, Kerala border till March 31st. Similarly, across the country, various state governments are taking steps to control the spread of the virus and mitigate its impact. Goa government has imposed Section 144, prohibiting large gatherings across the state. Section 144 will also be imposed in Puducherry from Monday. Tamil Nadu has shut its borders with Andhra Pradesh, Karnataka and Kerala, banning non-essential vehicular traffic from the neighbouring states till March 31st. In Jammu and Kashmir, the Waqf board has suspended prayers at the mosques and shrines. Delhi CM Arvind Kejriwal has announced relief to the poor hit by COVID-19 restrictions. 50% more ration would be provided free for those who are dependent on fair price shops. He has also doubled the pension given to widows, differently abled and elderly. In Maharashtra, Class 10 SSC board exams scheduled for Monday, March 23rd have been postponed. The decision about reschedule the exam date will be taken after 31st March. The West Bengal board exams have also been postponed till April 15th. As the positive cases of COVID-19 rise, India has revised its testing guidelines. Now all hospitalized patients suffering from severe acute respiratory illness, fever and cough and or shortness of breath will be screened for the disease. Indian Council for Medical Research has also asked hospitals to test direct and high-risk contacts who might be asymptomatic but have come in contact with a confirmed case. To control the surge in prices of medical supplies, the central government has issued a cap on the price of masks and hand sanitizers. A 2-ply mask will now be capped at 8 rupees and 3-ply surgical masks at 10 rupees. A 200 ml bottle of hand sanitizer will not cost more than 100 rupees. To ramp up production, distilleries manufacturing ethyl alcohol have been encouraged to manufacture hand sanitizers. India today sent an Air India flight to evacuate Indians stranded in Italy. The flight from Rome is expected to arrive in Delhi on Sunday morning. The centre has stated that no international flight will be allowed to land in India from March 22nd for a period of 1 week. Meanwhile, 215 evacuees, most of them students from Milan in Italy, who are in quarantine in ITBP's Delhi facility, tested negative for COVID-19 in the first test on the 7th day. A second test will be conducted on the 14th day. Moving on now to Janta Curfew, which will be observed from 7 a.m. to 9 p.m. tomorrow. Indian Railways will not operate any passenger trains from Saturday midnight to 10 p.m. on Sunday. Around 3,700 long distance and passenger trains scheduled for Sunday have been cancelled. Going a step further, the Bangalore City Police have decided to book cases and detain people who come on streets on Sunday. Even arguing with the cops may lead to a case being booked against you. Metro services have also been suspended in Bangalore and Mumbai. No taxis or autos will be available in Delhi as several unions have expressed their support for the Janta curfew. Meanwhile, as the lockdown continues in various cities, many artists are hosting virtual programs. Mythologist Devdutt Patnaik has started conducting story-telling sessions every day from 4 to 5 p.m. Classical vocalist T.M. Krishna will be accompanied by 3 other vocalists in a shut-in concert which will be live-streamed on March 29th at 7:30 p.m. The proceedings from the concert will go to the artists who are facing loss of income due to the cancellations owing to COVID-19. Before we go, here's a way to cross-check some of the WhatsApp messages or Facebook messages you receive. To combat fake news, WHO has partnered with WhatsApp to offer genuine information and steps to prevent further spread of the virus infection. Those interested can save the number on your screen. You can start by sending hi to the number on WhatsApp and you will start receiving health alerts by WHO. That's all we have for today. Stay safe, stay indoors, and for continuing coverage on COVID-19, log on to www.techandherald.com.